Okay, guys, so I guess I should do an update video. If you follow my social media, like my Instagram or my Twitter, a lot of you already kind of know what's been going on. But before I made a video, my mind had to process everything that was going on, and I had to tell my family everything that was going on. So now it's your guys' turn. I told you this year I was going to be brutally honest. There's a bunch of thoughts and things that I wish I had vlogged so I can look back on them, because still being able to look at my barium swallow follow through and my thoughts on that and stuff, like, best thing ever. So we're vlogging through this and we're gonna get through this, and it's more of an insight to my life, and so I can look back, or so if my kids have my problems, they can look at these videos and hopefully realize my mom did it. She's okay. I can be okay. So basically, last Monday I had my appointment with my new GI doctor. Yeah. It went really good. Like, honestly, I was scared. I was terrified. I didn't really have a lot of expectations going in it. Let me just be brutally honest there, because like I had like expectations and things that I knew I wanted GI doctors to do, and they never did them previously, and it was a letdown. So, anyways, I just kind of went in there, go with the flow, like just do the basic thing, tell my story, everything that I've been through, and stuff like that. So, anyways, I had gone in there expecting him to put me on different motility medications and stuff. I don't really know what I was thinking there. But anyways, he had looked at my tests, and he asked me if I had a proctogram, like a defecating proctogram, and because I hadn't had a colonoscopy, I had this defecating proctogram because of one of my problems. And basically, I was told my GI tract, so up until this point, when I seen him, I was told, like, your GI tract is slow, it's not working right, but there's no, like, physical abnormalities. Like, they told me about one, and they made it sound like it was okay, it was gonna be okay, no intervention was needed and stuff. I went there Monday, and he looked up on the computer, because that was one test he hadn't looked at, and he was like, oh my gosh. So basically, this is probably TMI. This is why my GI tract is slow, because my large intestines never worked properly in my life, and because I've went without treatment for so long, it's made my brain gut reaction thing, my brain gut reaction, whatever, you know what I'm trying to say. My brain is telling my GI tract move slower because my body isn't processing what's already there. So every time I eat, and it's just gotten slower and slower because I went without treatment for this problem. So basically, my last GI doctor explained to me that this is what your colon should look like, and mine just goes like this. No. What my colon does is, so this is a normal one, mine goes like this, and then there's a bulge like out here, and then there's one up. So it kind of is like shut here, it shuts here, because he did like this other test that I'm not gonna explain what it was. But anyways, basically, he goes, yeah, no, I can feel that it's collapsed, like that muscle is shut. Like, no wonder why your body's not working right. So basically, he goes, what have you tried for this problem? And basically, I told him, like, everything. Like 2 years ago, I was on like 12 tablespoons of Laxaday a day, and then I was still needing to drink like Pico-Salax or Meg citrate or something like that once every week to a week and a half, and I would still end up in the hospital like every couple months, and they would still be like, yeah, no, you're still really blocked up, so try this. And then I told him, like, so anyways, I did that for like a year and a half. So when I was in grade 10 until grade 11, I was doing that. And then, so basically, then we went on to the oral ones, like just taking like X-Lax and all those other medications that are on the market. Like literally, I had tried everything. We tried fiber supplements. We did the Resotran that I'm currently on, which actually I'm going to talk about that. So anyways, we did the Resotran, 2 megagrams. He's upping me until, well, I'm getting to that part too, but he's upping me to 4 megagrams, which it's a new medication, and no studies have proven that 4 megagrams is even worth trying, but it's worth a try. And so basically, yeah. Anyways, he goes, so anyways, we went through literally every x-ray and every test that I had, and every medication that I have tried, and every like diet that I have tried, and just my weight loss and everything. And so basically, because I've lost more weight, like I'm not gonna say numbers, but like I've lost more weight. And I have a dietitian appointment next Thursday, whenever the 20th is. So I think that's next Thursday. That's going to be my last one, because it's pointless trying to do this when I need surgery. So basically, I don't know what time frames for it or anything like that. He said because it's a chronic problem, it's not as urgent as if he's seen an infant with this problem to fix it before they got to the point I did, or if someone developed it like throughout their life. But because they've left me alone for so long, it's not as urgent as if someone was to catch it right away. If they caught this right away with me, I could have been long gone. But that test that showed my muscle collapsing and my bulges in my intestine had been there for 3 years. And everyone told me, you know, it's not a big deal, like blah, 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 it's okay, like just do this and it'll be fine. When really, in reality, it's not fine. It's actually very bad, because it's caused all my other problems. And now, because I can't eat because my GI tract moves so slow, so I get like nauseous and major stomach pain and stuff. My hair has fallen out. That's why I've gotten it cut. I have really hard time controlling my heart rate and blood pressure a lot, especially getting out of the bath or shower. If I go from sitting to standing, and I mean, I can make it look like it's nothing, like I can be in severe pain, like I have been for like 4 days, and like just carry on with my life, but like it just sucks. And so basically he said it's probably going to be 2 months until I see a surgeon. And then, so basically I have 3 choices. They're either going to take that part out, but there's no guarantee that that's going to fix it. They're just going to take it out and then reconnect my intestine. Or they're going to like give me an ostomy, which I'm really against, but you know what, if that's what it comes down to, and it's what it takes to make me feel better, then I guess I'm gonna go for it. But, or I'm getting a C-tube, like a cecostomy, which I would rather go for that as opposed to major surgery, because the recovery time's less, and just because my GI tract's still gonna be slow, it's probably better just to keep my intestine flushed out as much as possible, and it lays flat against your skin, so people are, unless I'm at the beach in a bathing suit, people aren't really gonna notice, and it's gonna be less awkward having that as opposed to an ostomy, because like summertime here, it gets really hot, you want to swim like you look really weird swimming in a t-shirt, and either way, that's not gonna hide it. So, yeah, that's basically what I've kind of been keeping from you guys. Well, not really keeping from you. I just, like I said, there were people who I had to let know first, and it was sinking in my head, and because it had been there for like 3 years, this answer, and my guess is it's probably worse now than it was 3 years ago. I was mad, and like I cried off and on like for 5 days, and like because I didn't know what to think. I mean, you're 20 years old. For years you've been told you're just gonna have to suck it up and deal with it because there's nothing you can do, and it's not like it's gonna kill you or anything, when come to find out you're now slowly killing yourself because you're not able to eat or hold your weight, and because you're in severe pain, and like you're risking infection after infection. And I'm kind of wondering if that kidney infection that I had back in August, where it took IV antibiotics and everything, I talked about it in a vlog, but I never really vlogged it. Again, I wish I did, but like I kind of wonder if it was the bacteria, because I read up on this too. I've did a lot of research like over the past couple years, but especially this past week. The bacteria can go from your intestine into your urinary tract, and because my stomach's slow and doesn't really absorb anything good, it went up into my kidneys. So was that what happened? I don't know. We're never really gonna know that, but I kind of think that's what happened, and it sucks because when they first found out, like when they first started like working towards a GI doctor with me when I was like 15, almost 16, that was how we found out I had a really bad like UTI, and then they're like, oh my gosh, like GI, she has a history of GI problems? What? She's never. And that's kind of why we worked towards that, seeing a GI doctor, and that's how I finally got to one. And we're on my 4th now, and this guy finally understands everything that's been going on, and it's just like crazy. And like this time last year when I had my barium swallow follow through, everyone thought I was going to need surgery then because they thought I had this twist and bulge in my small intestine, when really that test wasn't even necessary because it wasn't my small intestine, it was my large intestine, and that test had shown that 3 years ago. Prior to, well, 2 years ago prior to that test, but 3 years since I had that test, and it's just like, oh my gosh, like, it's insane. But basically, that's my update video. I wasn't expecting it to be that long. I do have a vlog that I've been working on for like a week that I need to update, and I'm also working on a video that's not going to be up until after I have surgery, so it's probably going to be months away, but it's going to be like my whole story and my journey to surgery and just stuff like that. And also, though, you're still going to be getting like vlogs through that, like my first surgeon appointment, and then my surgery day, and like my recovery from that and all that stuff. Like, you're gonna get follow me around vlogs too, not just vlogs where I sit here talking about how things are going and stuff. So yeah, because it's something that, as much as it sucks, like someday I'm gonna want to go back on it and think, wow, I got through all that and managed. So I will talk to you all later, and toodles.